Now, coming to stress, Dr. Cohen, you talk about the second pillar, the second, mix is stress. What do you mean by that, and what's the evidence that it impacts cancer patients?
So it's important to understand what we're talking about in terms of stress, because people say, well, my life is stressful. Life is stressful. There's kind of nothing we can do about it, right? Life's tough. And that's true. And, from an evolutionary perspective, aspects of stress have evolved with us. And, I posit that we have evolved from our ancestors who had the most sensitive and most rapid stress response, because the original, in some sense, purpose of this acute stress response was to help us get out of danger, to help us flee, to help us fight. It's colloquially called the fight or flight response. Increase in heart rate, increase first a processing of something dangerous in the environment that's threatening you, and then this release of stress hormones that originates from the thoughts in the brain, and it activates the body, mobilizes the body. And that's good in the short run. It'll help you run a race. It'll help you escape being attacked by a bear, and the like. In modern society, however, the threat isn't to our body, where running is going to help us. It's a work-related deadline. It's issues with family or friends. It's economic stress. It's, of course, the diagnosis of a life-threatening illness. Your life is literally threatened, and with cancer, from the inside out. And it is natural to have, for a period of time, this stress response. Where the evidence is really clear is that when that stress response becomes chronic, the response is the same, but the problem is that the body is constantly under this chronic mobilization, and it eventually starts to wear down and break down. And when it comes to cancer, we know that these stress hormones can get into the tumor microenvironment and make it more hospitable to cancer growth. And some of the seminal research on this came actually from Anil Sood's laboratory at MD Anderson, where he showed that in animal models, because it's not ethical to chronically stress humans in an experimental design, but if you take a group of animals and you chronically stress them, and you take another group of animals and you chronically stress them, but you also give them a pharmacological block of the stress hormone, that animal who's stressed with blocking the effects of the stress hormone, the cancer doesn't grow to the same rate as the stressed animal. Their cancer grows actually at the same rate as if they weren't being stressed at all. So that, in some sense, pointed to the stress hormones, and his work is focused on norepinephrine. Others have focused on cortisol, showing the same thing, that we really need to decrease the effects of the stress hormones. And this can be done, as was shown with the animal studies, and has been, in some sense, replicated epidemiologically, pharmacologically, with the use of beta blockers. Patients who are on beta blockers tend to live longer, and there's been multiple diseases, multiple cancers where that's the case: breast and lung and ovarian, prostate, the list kind of goes on. But there's also behavioral interventions that are probably safer and, in the long run, ultimately more sustainable and will have multiple beneficial effects. And of course, the use of a beta blocker may be contraindicated for a lot of people. And so what does that look like? It's finding a period of time, ideally multiple times, throughout the day where you can create calm, where you can calm down the chattering mind and the thoughts that are jumping, as they say in the Buddhist philosophy, the monkey mind, where your thoughts are jumping like a monkey from limb to limb, and calming that down for a period of time, ideally at a minimum 10 minutes, either through diaphragmatic breathing or through meditation, ideally for a longer period of time. As you get better at engaging in what could be called this relaxation response, then you can activate it in real time. So, yoga is another really important mind-body practice. And in fact, the evidence base is probably the strongest for controlling multiple symptoms, as well as improving immune function, decreasing stress hormones, etc., compared to other mind-body practices. The more you engage in this, the easier it's going to be to engage these processes in real time. So, an adept practitioner can, when they're feeling that they're in a stressful situation, engage in 3 or 4 deep diaphragmatic breaths, and everything just calms down, even though they're in a challenging situation. At first, when you're in that challenging situation, you haven't practiced the mind-body practices a lot, you will respond more with that fight or flight response. So it's a practice, just like any skill that we're trying to learn. What we're needing to do, in fact, is overcome our evolutionarily innate, hardwired system that kept us alive for the majority of time of human existence. So, I think, just a brief diversion, if we think about, and this applies to diet, it applies to exercise, it applies to stress. And that's why in each of the chapters, we kind of talk about very briefly the evolutionary perspective. Because if we think about the existence of humans on this planet, it's about 200,000 years or so for Homo sapiens. And it's hard to think of 200,000 years, even if you break it in chunks. So let's think of it as a 24-hour period of time equals 200,000 years. We were hunter-gatherers and living in this, very physical agrarian world, where we were moving a lot, where there wasn't necessarily a lot of chronic stress unless it was related to famine or weather-related issues. The predator stress tended to be acute, as well as warring clans and stuff like that tended to be of an acute nature. We ate primarily whole foods because there wasn't processing. It's estimated about 58 and a half minutes of that, of the 60 minute period of time that's equivalent to the 200,000 years. And it's only in a minute and a half that represents about the past 10,000 years, which is the agricultural society. And then if we look at modern society, certainly the transformation of our food system, how people are engaging at work by sitting most of the day. 80% of our population is in sedentary jobs, whereas in the past, 80% were in agricultural jobs and moving in every day. That's just a fraction of a minute. That we've really transformed our society in that way. So it was adaptive for us to respond in this physiological way to danger and threat in our environment. And our body's still responding in that way. So in some sense, we have to practice to overcome our evolutionary past and respond in a way that's going to ultimately be better for that situation, and very importantly, better for us physiologically. And, when people say, well, there's so many different mind body practices, there's meditation, there's Tai Chi, there's Qigong, there's yoga, there's, from the Tibetan tradition, there's 80,000 different kinds of meditation. If you look at them from the 30,000 foot view, they may look different. A seated meditation versus Tai Chi. And Tai Chi, there's no contortion and moving of the body like there is in yoga, but the ultimate goals are the same. And the best one is going to be the one that you'll do every day.